Brain tumors constitute a significant disease load on neurosurgery. Brain tumors occur at all ages, starting from the infancy all the way up to the old age. Brain tumors basically can arise from any structure within the brain. Now, the tumor can arise from the skull bones, from the membranes that cover the brain called the dura. It can also arise from the blood vessels. It can arise from the brain parenchyma. And within the brain parenchyma, depending upon the type of structure it arises from and the cell, the brain tumors can be classified into different types of tumors. Nevertheless, a tumor is an abnormal growth inside the brain. Since brain is situated in a closed, rigid cavity called skull, it cannot expand further. The contents of the skull include the brain, the blood that is circulating within, and the cerebrospinal fluid. When any additional growth that happens inside the skull, it displaces all the three structures. Primarily, the cerebrospinal fluid, it will get pushed, then the blood flow gets redistributed, and then the brain itself starts pushed out to another location depending upon the size of the tumor. When such thing happens, there is pressure that is built up inside the skull since it is a closed cavity, and that pressure is the one which leads to headache. So headache is the predominant symptom in the brain tumor, and this headache, obviously because of increased pressure, it is progressively increasing. Normally do not respond to the analgesics or medicines that you take for the headache. Usually occurs in the early morning, associated with blurring of vision or projectile vomiting, sudden vomiting. Often vomiting reduces the headache temporarily, and this headache keeps progressing. So these are the typical types of headache what you get in a brain tumor, and eventually, depending upon the location of the tumor, also other symptoms will come up. Now, one of them is a headache. Second one, if the brain is getting irritated, it will cause convulsions. It will cause neurological deficits finally. Now, the neurological deficits depends upon the type of the tumor and the location of the tumor and the speed at which it is growing. If it is located in an area where it is concerned with the hand and the leg, it will cause weakness or the numbness. If it is in the location of the speech, it will cause speech disturbance. If it is located in the balance area, it will cause difficulty in walking and imbalance, difficulty in swallowing, difficulty in vision, hearing, etc. So finally, if it is neglected further and they become very drowsy or unconscious. So till then, no one should wait. At the earliest, when the headache is not responding to treatment and progressively increasing, it is time to investigate and rule out a brain tumor.